Hey guys, happy Wednesday. This is Vicky. Just giving you a quick update. Another good tip to know about keeping your heart healthy and strong. Celebrating National Heart Month. We've established in my previous videos that are on the YouTube channel. Check them out. You know, heart disease is the number one killer now with men and women in our country, killing over 600,000 people last year. Many forms of blood cancer, heart disease. You know, we've covered a few of them. Talked about salt intake and how it relates to blood pressure, untreated blood pressure leading to stroke, those type of things, all different types, congestive heart disease, coronary artery disease, many types. What I want to do today is talk about something that you guys can quickly relate to. Okay, how does vitamin D relate to heart and heart health? Real quick, just want to let everybody know that, you know, obviously reducing any risk factors you can, smoking, drinking alcohol, lack of exercise, these are amongst the top, obesity are amongst the top to having diabetes, top risk factors contributing in blood pressure towards heart disease. You know, you want to get those under control. That's important. It's amazing, just like I've taught fitness forever, a little bit of clean eating and a little bit of movement would just alleviate so many problems. It's crazy, you know. It's no longer you're subject to something just because a disease existed in your family. There are many lifestyle components. You are in more control of your health than you know. So let's talk about what's the scoop with vitamin D. It's been all over the news lately that, Johns Hopkins University, Harvard, that's where I do most of my studying from, Mayo Clinic, that most Americans now have a vitamin D deficiency. It's lowering people's immune systems. People are getting sick more. But there's also a direct connection with vitamin D and how it affects our heart. So let's look at this real quick, okay? First of all, what do we know about vitamin D? And yes, this is the crazy Professor Vicky and my board again. Okay, vitamin D, as a lot of you guys knew when we were kids, we drank it, right? It was in our milk. You know, you can find vitamin D in fatty fish, fortified orange juice, or milk, right? So, you know, it kept our bones strong. That's what we were told. And that's the truth. But let's talk about some other things. What else does vitamin D do? It helps with lowering blood pressure in our body and also in our kidneys, reducing internal inflammation. We know that that's the root of most disease. It improves muscle function, especially with respect to the heart. Remember, our heart is a muscle. Okay, other things vitamin D does, it helps regulate blood sugar. This is a really big thing, folks. Vitamin D, and a lot of people don't know this, keeps abnormal cells from multiplying in breast and colon tissues. Really important, okay? So why are we talking about vitamin D with relationship to heart health? Okay, there's still some elements missing in science, but there's enough that it's made all of the large medical associations that they all agree that one thing that keeps coming up over and over again is that people with the highest levels of vitamin D have a 43% reduced risk of all types of heart disease. I don't know about you, but I say that that's not a coincidence. That's pretty significant. So, okay, Vicky, so now I know I need vitamin D. Where do I get it from? I've heard about the sun. Of course, the sun provides the most amount. And what it means is that when the sun touches your bare skin, okay, your body actually produces vitamin D. So that is the best source. It's from the ultraviolet B rays. Okay, there's a lot of factors. Real quick, you would think just like a lot of vitamins and minerals, you can get it from food. Just want you to know it's been proven, even though vitamin D is in fatty fish, fortified orange juice, milk, you cannot get the amount you need from food. So what you want is, if you can, under the right circumstances, get it from the sun. Okay, or turn to supplements. Actually, interesting to see Harvard, Johns Hopkins, they're all talking now about getting vitamin D3 because vitamin D3 is considered best to get supplements. Why? Because of all the conditions that need to be perfect to maximize this, to really get the sun. Okay, so let's talk about this. How do you get it from your skin? Okay, how would I get as an adult somewhere between maybe 2,000 and at least 5,000 international units a day? Okay, children should have somewhere between they say 1,000 for every 25 pounds of body weight. Depends if you look at the Vitamin D Council, Food and Drug Administration, the Endocrine Society, but I'm seeing more and more results saying upward bound. So kids need to have between 1,000 and 4,000 a day. We as adults can get away with as low as 2,000, but if you have other risk factors, as you're getting older, just different things, you need more. Just in my world, I try to make sure everybody I know and care about gets at least 5,000 international units because we're fighting so many carcinogens and just different things every day. Our body's up against it. Our immune systems are working 24/7 on overdrive. So let's talk about it. If you are going to get it from the sun, you have to know that there's a couple of things. Number one, you want to expose yourself half the time it would take for your skin to turn pink. Now, guys, there's too many variables. I'm going to post a link from a great article from John Hopkins under here. But it has a lot to do with people with pale skin. They have categories 1 through 6. Okay, somebody who's very pale, your body can absorb vitamin D faster, so it takes less time in the sun. Somebody with darker, right, the melanin, darker skin, it's going to partially block, so they have to be in the sun longer to get the benefits of vitamin D. It also depends on time of day. It's been proven that midday sun is best. See, the problem is when you're beginning of the day and end of the day, the way the angle is on the atmosphere, the UVB rays get blocked. That's just a fact. The closer you live to the equator, the better it is. The further away you are, it's harder. You have to be in there longer. The amount of body exposure, some people make the mistake of just tanning with their arms and their face. They recommend getting larger surfaces like your stomach and your back. Again, a little period of time. Now, under the right conditions, folks, before anybody gets scared here, if you're in the midday, like give you an example, Florida versus Boston, right? Florida, you can kind of get it all year long, right? Because we're closer to the equator and whatnot. Let's take a city like Boston. It's almost impossible between November and March to get the type of UVB rays that you need. Canada, between October and April, it's nearly impossible. So they definitely need to get the supplementation. But it has to do with time of day. So you want midday sun, close to the equator. What time of year? We can, middle of the day, I already said this, pale skin makes vitamin D faster. The amount of skin shown, the more skin, it's better. Sunscreen. Here's the problem, folks. Here's our great dilemma. We were told as kids, get sunshine, get sunshine. And then with the dissipation, because all the pollutants, our ozone layer's been breaking up. It's been allowing a lot more like cancerous type rays in. So now our parents have us all scared to death, and doctors make, man, we better have sunscreen on, right? And there's truth to that for sure. So the good news is the sunscreen will prevent you from certain types of cancers. I'm not here to, scare anybody, but there's also a difference between squamous cell carcinoma, by the way, which it's been proven that sunscreen helps, but basal cell carcinoma, which is also deadly, is not. That's a big myth. You can still get that with sunscreen, but that's a side note. So the problem with sunscreen is it blocks most vitamin D production. Remember, back here, we want strong heart health. We need a lot more vitamin D in our body. We know that we can't get enough of it from food. That's a proven fact. You just can't get enough of it. So we want to get it from the sun, but it has to be under these perfect conditions. More and more, the scientists and everybody are saying actually get vitamin D3 supplements, okay? But one more thing, pollution in the air is blocking the UVB rays. Being behind a glass door, it blocks the rays. Okay, with babies in general, you always want to think about giving a baby supplements. All the doctors agree because of their fair skin. It's not risk of them burning. So that's another fact. Here's another thing, okay? What am I always talking about, folks? Right? Preventing obesity. Obviously I'm in a fitness center environment right now. We try to make people feel really good about, showing them ways that they can, incorporate some movement and clean eating to reduce body fat for lots of reasons. I've mentioned recently, I'll do another video, that now there's several types of cancer that are directly related to obesity. It's no longer about, if it runs in your family, just so you know. Well, once again, obesity is rearing its ugly head, because check this out. Obesity, okay, what's the problem with obesity and vitamin D? Well, fat cells absorb vitamin D, which prevents them from circulating in our body. Another reason to lose the extra body fat, folks. So, in closing, I'm hoping that most of you guys understand that it's all over the news. Most people in our country now are considered vitamin D deficient. We know that 1 in 4 people will die from some form of heart disease. Let's make sure that we do everything we can to get ourselves healthy, right? We know that people with the highest amount of vitamin D have the reduced risk. We'd love to get some sunshine. I'm going to add a link, but if you could get in the sun in the perfect conditions, for 15 minutes, 3 or 4 times, 15 to 20 minutes for someone with like the average skin tone, in the middle of the day, in the right place, 4 times a week, you'd be fine. Best bet is find a really healthy vitamin D supplement. I know I take one after a lot of research that's very bioavailable so that my body can absorb it. That's real important. I've also found one that combines that with an amino acid, L-arginine, that helps our body, improve circulation with nitric oxide, and that helps reduce blood pressure as well. So you find one that works best for you. Again, my wish for you is that you live a long, healthy life, but understand one thing. whether you're a God-loving, fearing person or not. You know, a lot of people say, I just pray to God, I pray to God. Well, guess what? God gave you a brain to use it, and he gave you a temple to guard and nourish. So you need to make smart decisions. You need to trust in yourself that you know more than you think you might know. Get some movement in your body. Eat the right foods. Okay, today we talked about vitamin D, and vitamin D3 is the one preferred by the health professionals. Get it in your system. Okay, guys, it will help you. Again, have a fantastic day. Let's do everything we can to, really significantly reduce that heart disease statistic. God bless you all.